Please be aware, in this podcast series we talk about all areas of safeguarding, which some people may find upsetting. So please make sure you're okay listening to today's topic. Be mindful of those around you, such as children, that you might not want to listen in. Hi, I'm SSS Safeguarding Director Sam Preston.
And I'm former head teacher and content author Sara Spinks.
So today we're talking about serious case reviews, Sam. It's something we hear about in the press, but can you explain what it actually is?
Yeah, sure. In short, serious case reviews, they take place when something goes seriously wrong. They're an in-depth multi-agency review, and they're usually conducted following the death or serious injury of a child due to abuse or neglect, or where there are concerns about how organisations or professionals worked together to protect a child.
Yeah, one thing I've noticed is that when it's announced that a serious case review is going to happen, there's a lot of media coverage, leading to speculation, which triggers a kind of blame culture, which, was the case in the recent tragic case of Kenneth Battersby and his 2-year-old son, Branson, this Christmas.
Yeah, unfortunately, you're right, Sarah, and that is really unhelpful. In the case that you're referring to, we don't know what's happened yet, and there's all sorts of speculation, the roles of the professionals involved. And until the findings of the rapid case review are released, we won't actually know. So it's important to understand that these reviews are essential both to get an accurate picture of what happens and to identify areas to improve the child protection system and hopefully prevent similar incidents in the future.
So is it a learning process?
Absolutely, yeah.
So it's announced that a serious case review is to be conducted. What happens then?
Okay, so the process involves several key steps. So the first involves gathering information. That's collecting detailed information about the case. So this includes reviewing all available records, interviewing professionals involved, and understanding the family's history and circumstances. So it's quite an intensive part of the review process. So it's essential that any organisation has really robust recording in place.
Yeah, one of the reasons that schools should keep really accurate records.
Absolutely. In fact, any setting working with children and young people. The next stage is a thorough analysis of the case, and this will identify what went wrong, what could have been done differently, and any systemic issues that contributed to the child's harm. That's followed by identifying lessons and making recommendations to improve practice. And this may include recommendations for individual professionals, for agencies, or indeed systemic changes.
So how are findings shared and how does changes happen?
Yeah, so the findings and recommendations from the review are shared with the relevant agencies and professionals firstly. It's essential that these findings, together with any recommendations, are communicated effectively to those who can implement change.
So based on the review's findings and recommendations, I'm presuming that will lead to training and professional development programmes, to ensure that professionals are better equipped to prevent similar cases in the future.
Yeah, but however, if systemic issues are identified, changes to policies and procedures within agencies and organisations may be necessary, and these changes should be implemented properly, really. But that said, there are some major overarching difficulties with this. For example, we know there's significant issues with the retention of social workers. So more social workers are leaving children's services in England than are coming in to replace them. Government workforce statistics show that in the past year, 5,400 whole-time equivalent social workers left their jobs, and that's an increase of 9% on the previous year. So that directly impacts the caseload capacity of those still in post. Another example, the Institute of Health Visiting, their report, The State of Health Visiting, highlighted a national shortage of around 5,000 health visitors in England. So with 79% of staff, they're saying health visiting services lack the capacity to offer a package of support to all children with identified needs. So, we can't magically solve these issues overnight just because we've had a serious case review.
Absolutely. What about accountability?
Well, individuals and organisations are accountable for any failings identified in the review, and this may involve disciplinary actions or legal consequences where necessary. But as I've just described, there are major factors in the capacity for maintaining services, never mind improving them.
Such a really worrying picture.
Yeah. And, it's not a new picture. A radical reworking of strategic multi-agency development and working practice is needed.
So getting back to the reviews, does this information come into the public domain?
Yeah, the review summaries are usually published in a way that maintains confidentiality and respects privacy. But, this can help raise public awareness of the importance of child protection. But, to sum up, learning from serious case reviews is a critical aspect of improving our child protection systems and preventing future harm to children. The goals to ensure that lessons are not just identified, but also translated into concrete actions and changes that enhance the safety and well-being of children. However, as I've said, there are systemic difficulties which can make this challenging. And until we have that systemic reform, really think about our core structures and how they could better operate, we sadly will see safeguarding tragedies due to this, this systemic failure.
Lots of change still needed to be happening. Thank you, Sam.